am Dr. P, and today we will be performing a ear and eye exam. So you say you do have some symptoms, is that correct? Okay, so we will be looking at those today, but before we get started, I would just like to confirm some personal details and then also discuss your symptoms. Okay. So just confirm your name and date of birth. Okay. And your address and street. Okay. So tell me about your symptoms. Okay, so you do have some pain in your eye. Okay, the left eye. Okay. And how long has this been going on? Okay. And your ears, it has some tenderness. Okay. And how long has this been going on? Okay. Do you have any other symptoms? Perhaps some lightheadedness, dizziness, okay, and a fever. Okay. Okay. So that is all done. So we can go ahead with the examination. So firstly, I would just like to listen to your breathing and your heart rate. Okay. So just breathe in, take a deep breath in, let it out. Okay, and again, and let it out. And again. Okay. Just going to go around your back. So breathe in and let it out. Breathe in, let it out. Okay. Everything sounds good to me. Okay. So I'm just going to put on some gloves. So I'm just going to go ahead and press onto your face, especially the eye area, just to see if I can feel some swelling or anything like that. Okay. Is that okay? Okay. So I'm going to go press. And you can close your eyes. I'm just going to feel your eyes. Okay. Close it. The other one. Okay, just going to. So everything feels fine for me. I don't feel any abnormalities or anything like that. Okay, so what I want to do now is I'm just going to measure your eyes. Okay, so this is not usually standard, but it's a new procedure that we have put in. So it's just to make sure that your features are in the normal range. Start with the one eye, and you can close your eyes for this one. Okay, now the other one. Okay, so now I'm just going to measure in between your eyes. Okay, the other side, and this side. Okay. Let me just make a quick note. Okay, don't worry, it is within the normal range. Okay. So what I want you to do now is follow my fingers. I'm just going to move it around, and I just need you to follow it. Okay. So let's start. Okay, follow. And now this side. Okay. And yeah, this side. So now what I want you to do is just keep your eyes on the spot. Keep your eyes here, and you tell me when you do not see my fingers anymore. Okay? And again. Okay. So I'm now just going to do one more close up. Okay, so follow my finger. Okay. is wonderful. That is good. You are doing really good. So now I just need you to follow the light. Okay, so it might be a bit bright. So if it's too bright, just let me know and I will stop it. Okay. So just tell me when you see the light. Okay, that is great. So now what I'm going to do is I'm going to examine your eyes with the light. So it might be a bit bright, but I have to see what is going on, if we can see what is causing the pain. Okay. So I'm going to start with the one side. So I'm just going to keep your eye open. And now the other one. So I can definitely see an object over there. So I'm going to have to remove that for you. So it might be a bit uncomfortable, but it won't be so painful. Okay. So the best thing that I think I'm going to do is just going to give you a little anesthesia in your eye, just a little, so you don't feel the scraping. Okay. So I'm just going to give this to you. Okay. And can you please, I'm just going to hold your eye open like this. Okay. Let me just remove this. Okay, so I'm just going to get okay, so I'm going to shine the light in and I'm going to try and do it as quickly as possible. Okay, so keep your eye open. Okay, I think I have it. It is like a small piece of thing that sometimes happens, things get stuck. Okay, so now I just need to clean the area. Okay, so the first thing I'm going to do is I'm just going to brush it, okay? So keep your eye open. Let me just help you a bit. And just the other eye as well. Okay. Now I'm just going to pat with some medicine. Okay. And I'm just going to wipe it a bit. And the other eye. Okay. That is all done. How does it feel? It will burn a bit right now because of all the stuff that we have just done, but it should feel much better once it has calmed down. So next up we will be continuing with your ear exam. So the first thing that I just want to check is your throat. Okay. So can you just open your mouth? And I'm just going to brace. You just have a look. Okay. That does not look too bad. So I'm just going to do the same thing as I did with your eyes. I'm just going to feel a bit. Okay, now the other side. Once again, I don't feel any abnormalities or anything. Okay. So now I'm just going to do a close up check inside your ears. Okay, so going to use this tool. Okay, the other side. do see some blockage inside your ear. So I'm going to be cleaning that up for you. So I'm going to start with this ear. Now the other one. Okay. So I think we have the big parts out. So now I'm just going to use this tool. So let's start with this one. And now the other side. So now I'm just going to use the same liquid to just clean the area. just going to use this cotton pad to clean the outside also. Okay. That is all done. We just clean everything, wipe everything. I think we are all done. You have done so great. I think all the obstacles are removed now, so you should not be experiencing any pain anymore. Okay? So I'm just going to have a quick check, final check. And then ears. Just check. Okay. Everything looks good right now. There's a little bit redness, but it should go away as soon as everything has settled. I'm just going to give you some pain medication that you can take if you do feel a bit of pain. You can just chew it, you don't have to take water with it. So you can take these 3 times a day as necessary, okay? And then I also have some cleaning pads that you can use if these are safe to use. Then you can just wipe them off. Okay. So you have a lovely day further now, and I hope that you will feel really better